I am pumped about tonight. We have an amazing panel, and I'm just going to go through. I had to write notes because my brain fog will like just skip right over, and I've got like a dead eye. So we have Dr. Suzette Clements joining us this evening from Georgia. And Dr. Clements tonight, everyone's going to be able to share their stories with all of the different clinical indications that the REMY treats. But I've asked each panelist to share a specific story with one of the functions that REMY does. And there's a lot. So I've asked Dr. Clements to share a story this evening about pain and inflammation. And I love the way that you discuss the natural healing and the way that you go about that in your practice and the way you communicate with your patients about that. So I'm excited to hear your take on that. We also have Matthew Butler from Massachusetts. I won't call you a hole tonight, but I like to do that behind the scenes. And one of the things that I love to share about Dr. Butler is he definitely took advantage of his marketing kit. So I loved working with you on all of the marketing tools that I customized for you. And with that, you told me yesterday that you were able to pay off 2 lasers within 1 year.
Yep.
So this works. So there's kind of no fear in the investment. We also have Dr. I never know if I should call you Paul Clint.
I answered all of them.
Perfect. So Dr. Jones is here to share his experience with warts and IPKs. We have some amazing training videos with some of the procedures that come from Dr. Jones' office. Dr. Jones also went wild with David and added an additional function with the REMY that we're not even really covering tonight. So it's like it never ends with matrixectomy. I can't say it. I'm not gonna lie.
Matrixectomies.
Toenails. So we're not going to really like do a ton of that this evening, but we did have an extensive webinar on that in March of 2023. And I'd love to share that. Dr. Jones, I know you did share with me some images via email of some of your treatments with that. So I do have those that we can share, but I'm very excited to show everybody your before and afters on the wart treatment. Dr. Sandford, you are joining us from the Cairo world. So I don't know how to feel about that.
Guilty. Yes, guilty as charged.
No, we're excited to have you, obviously. And you're going to be discussing your experience with neuropathy. And we definitely have a lot of podiatrists using the REMY for nerve treatments and neuropathy. But we were really excited to have you join us because that is your bread and butter. And you are just rocking it. And then we have Dr. Ho-Ellsworth, and you're here really to show us how you can tie all of this together and generate an amazing cash practice. The way that you have taken all of the functions of the REMY, and I love watching how you use marketing and the way you use social media. You're doing it right, and I mean, you're thriving. So
hey, that means a lot coming from you.
What's that?
I said that means a lot coming from you.
No, you're doing it, and that's just half the battle because it takes so much time, and to be able to post regularly and consistently, that's just a battle. And so to commit to that, kudos. And so what I would like for everybody to do is just go in that order, if you can remember it. So I'll remind you as we go. So Dr. Clements, I would love for you to start, but then when we get done, we'll open it up to questions. So Dr. Clements, I'm gonna let you take the reins here and share your experience with pain and inflammation.
Wonderful. Thank you, Sarah. Thank you, Anne. Thanks, David, for the invite. You know me, I love to talk, so I'm always up for these things. So, in terms of pain and inflammation, I love Remy, and I mean that. And I'm not just saying that. It has made a huge difference in my practice, and I think because I'm very holistic in my approach. I was surgically trained, but I always look for ways to help patients heal naturally. And the reason for that is I believe at the core level, our bodies are designed to heal themselves. So as a result, I look for products that are actually going to help patients heal on a faster level. And Remy has delivered that tremendously. So I use it for all the inflammatory conditions, the Achilles tendonitis, plantar fasciitis, all of them, neuromas, ankle sprains, every last inflammatory conditions. I also have shockwave, but it's hard to do a shockwave before you quiet that inflammation down. So sometimes I'll actually do the Remy first, pain laser, and then later on I'll do the shockwave. It just makes sense. And so one of my greatest testimonies with Remy for Achilles tendonitis, one of the Kaiser doctors actually referred a patient to me. She'd had Achilles tendonitis for over 2 years. She'd been limping. She was miserable. She brought in a bag of all of these things they gave her, the night splint, everything. And I had her set up, and we do it once a week. And I had her come in, and after the first of all, after the first treatment, she was able to walk out with significant improvement. And to me, that is very important, because when you walk in limping and you walk out and you're not limping, that's a big deal for someone who's had pain, chronic pain for over 2 years. And she was about 85% improved after the third treatment. And it's incredible, because now she's like, well, why wasn't I introduced to this earlier? You know, they go on to this whole thing. And I'm like, it's good to know that we have these healing modalities and non-surgical. You come in, it took about 10 minutes to do it. I typically have patients do for Achilles tendonitis in the prone position, because I feel like I can get a little bit better, because I dorsiflex and plantar flex at the ankle joint while I'm doing it. But tremendous improvement and almost instantaneous. And typically I will put these people in a soft cast and a boot, depending on how inflamed they are. So it just depends on what's going on. That'll determine my post-treatment. But I've had nothing but positive overall reviews with Remy.
I have a quick question. If I wanted to ask Dr. Clements, how often, how many treatments do you do? I know the timer's usually on 5 minutes. How many for the Achilles are you doing? I was doing, like, in a 15-minute session, I was doing 2 10-minute, or, you know, a 10-minute session total.
No,
How
I
did you do that
actually,
first one?
what David set up for me is what I do. So I do the 5 minutes, and sometimes I'll change it to pain, because there's a pain setting that I can do as well, or versus the Achilles or the specific location of the body. So typically no more than 10 minutes. And I find that they do really well with that, because if you're going more than that, it tends to go a little, the heat, that you're trapping the heat a little bit more.
Yep.
So 10 is the sweet spot that I've found so far.
And it's on the pain 25 setting.
Yes.
Yes.
Okay, yeah.
To answer your question, Dr. Butler, so I typically do 6 10-minute treatments, and I do them weekly, and that usually does it. They're usually pain-free by about the fifth one, and I do the 6 as a courtesy or something like that.
Same thing. I'm glad you mentioned how many visits that you do in a package, because that was helping me. I was wondering how much I actually have 2 people with Achilles tendonitis right now, and I'm doing a 10-minute treatment total. And I told them, like I said, 4 to 5, possibly longer. And I just wanted to share, before I talk about fungus really quick, I have a guy that I was very proud of, kind of similar to what you had said, Suzette, with your patient, Dr. Clements, coming in, where had tried all kinds of stuff, 2 years at least, if not longer, for everything for plantar fasciitis, a 75-year-old plus male who did a lot of golfing, very active, and could not get rid of his plantar fasciitis in the arch, and no matter what he did. So he started doing the Remy, and I will say also, like yourself, by the 5th, 6th treatment, he started to notice a dramatic improvement. That's the sweet spot. So we lengthened it, and by visit 10, he was completely pain-free. So that's when I realized this thing is really special, because this guy had exhausted all other lasers. I mean, all other treatments. He's done, injections and physical therapy and orthotics and shockwave. And I mean, he had done it all. So I like to defer to that. But I think Sarah, you want me to speak on fungus?
I would love that.
Okay. So my exposure to onychomycosis, forever and ever and ever, as I told Dr. Zuckerman before meeting him, I was always thinking that it was super expensive to purchase a laser, that, it was questionable how much it worked, that it was a single, cost item where people had to pay all kind of money. And there was another laser company that was out there, and they were kind of dominating the market. But then after COVID, I realized so many people were coming in and saying, I need something different besides pills. Is there anything? And I realized I had to start looking at another venue. And then through a rep that used to work for Dr. Zuckerman, he told me, did you ever hear of the Remy? It's like the Swiss Army knife of podiatry. It has many different other applications, including fungus. So long story short, I mean, like I said, I could talk about the others, but I could tell you with fungus, all I've done is in my area, I run Google ads, and I have a very good web guy that does that. And what surprised me more than anything, I'm in just north of Boston. I was getting people from Connecticut. I'm getting people from New Hampshire. And I'm surprised that a lot of podiatrists are, whatever they're utilizing, if it's the ketone laser or whatever, I'm finding like they're telling me it was burning them, that they were having issues with it. It was super expensive. It was a single visit. They're really encouraged when they come through the door, and people will come through your door. That's the thing that surprised me. I'm like, who's going to get this? I have everything from older folks to younger people. I mean, they will come in if you just advertise that you have a laser, and it's a real straightforward process for me. I offer them, and I don't know if we're allowed to talk about money, because I wanted to ask if that would be okay to ask what people are charging, because I have like a certain price point that I use, and I include certain items. I don't know if we're allowed to do that, but that would be
Please
great.
do. Yes,
Okay.
we are
So
allowed
what?
to talk about
Right,
money.
cool. So what I do is, and I don't know how I came up with this. It was probably through several other foot doctors, but I charge $875. And in the very beginning, I went to one of these webinars, and people were saying 8 visits, right? So I'm like, God, and I was doing it every 3 weeks. And after a while, you're like, oh my gosh, I'm married to this person. I wonder if there's anything different. I mean, they all were getting better, which was great. But I'm like, gosh, I'm filling up my treatment room. Am I being as efficient? So Dr. Zuckerman said, do 4 visits. So now I'm advertising $875 for 4 visits. But I'm finding, kind of like Dr. Clements, I add in a complimentary 1 or 2 visits on top of that, because I'm finding the nail growth takes a while to grow out. And if people aren't completely satisfied, everybody wants all at once everything to look better. And I tell them it takes about 4 months or so just to start to grow out, and it could take up to a year to look even better. I read something like that last week. So long story short, I would love to know others, what are they offering? Is it 8 visits? Is it 6 visits? And what I do is I also include in the package, like I'll include a topical from, I don't know if I'm allowed to mention the competitor, but I offer a cream, a topical, an antiperspirant, and I put that in the package. So it's like the suspenders with the belt, which is the Remy. So they're kind of engaged.
I always like to give credit. I'll tell you where I came up with the 4th treatment. It was Dr. Ellsworth. Because you did 3 treatments and then you brought him back. I think it was 4 to 6 months.
So I do
love
what
that.
so I do monthly 1, 2, and 3, and I take progress photos from the beginning and at each visit. And then I just let people know that, hey, the rate of improvement is dependent on the rate of growth. And toenails grow 1 millimeter a month. And I compared that to a fingernail, which is 3 millimeters a month. So that kind of gives them idea, especially for women. It's like, hey, how often do you get your manicures? How often do you get your pedicures? That kind of gives them a gauge. So the rate of improvement is going to be dependent on how fast those toenails grow. And so by the time I see them at month 3, I tell them right around month 3, and then their next treatment is 3 months later. That's the 4th treatment. So I tell them I sell mine for $1,000. I don't include anything else. Everything else is, they pay extra. But I show them their progress photos from that 6 month, from the beginning in the 6 month. And that's when they really see the difference. And that's when they really believe. Because day in and day out, they stare at it. It's like watching paint dry. You really can't tell the difference.
Yeah.
Right.
So I think if you put it that way, it really kind of sinks in that, okay, I can expect, you know, their expectation that, hey, by the third treatment, they're going to be set up for disappointment if they're going to go, oh, well, I haven't seen any improvement, right? But that's why I like to add in that fourth treatment. And occasionally I'll throw in an extra treatment. I don't discount it, my packages, but I'll throw in an extra treatment, kind of like what Suzette does. If it's really, you know, kind of recalcitrant, it's not doing anything, I'll have them come in like the next month or 2 months and do that.
And I'll tell you, my price is actually higher. I do $19.95 for 90 days, which is they're coming in once a month times 3, and we offer care credit if they want to do it. It's really in your presentation to let them know, hey, you've had this for 5 years, and I show them like the nail growth, like you just said. And I let them know it may take a year, may take up to 18 months, but you're going to start to see it. When you come back in 3 months, we're going to see some proximal clearing, and I show them that. So they know that it's an investment. And I say, hey, people come in, they pay it every time, all the time. We're going to pay for what we deem to be necessary or important. So if this is important to you, then it's important to us as well. And initially, it was like, I had to get over my own limiting belief to put that $19.95 out there. And once I did, and I realized that, yes, I'm giving a huge value here, then it was not a problem. Patients came in and they're like, you mean per visit? And I was like, no. So I was like, okay, maybe I'm undercharging, but no, I still keep it at that point. But the point I'm making is a lot of times when we're uncomfortable sharing the price point, is because we're uncomfortable with that. It's not the patient. And patients come in, they're like, well, can I get started today? And I'm like, well, let me see if we have the time. Knowing good and well, we're going to find the time to do it, you know? And a lot of people want to pay up front. And so we're like, okay, perfect. We'll do that. And the other thing I add is that my price includes the products, because I say, I want you to succeed. I want you to have what you need for success. I don't want you to go out there. You're not going to go to Amazon. You want to have it. This is my recommendation. And we include a shoe spray as well, because I tell them, if you don't treat the skin, if you don't treat the shoes, don't bother treating the nails, because you're going to cross-contaminate. So I have a whole, and social proof is very important. And I can't remember who helped me to create my posters for the office, but the posters look like this. And oh, thank you much, Sarah. So this is what it looks like. So I'm really just talking, and I say, hey, the number one thing I treat is fungus, right up there. So people see it and they know. And I said, when we're talking about it, this is what we're talking about in terms of fungus right here. So I'm showing them and they're like, okay, exactly. And then I give them the list of how we treat it, and this is our price, and let me know how you want to move forward. You'll just call the office and schedule. And then I walk out and my staff reiterates what I just said. So you know, it works, but the product works.
So that's 4 visits. That's what you give. That's what you do, or 3 visits?
3 visits. I do 3 visits, and I do a complimentary one if they're not seeing significant. I'll do 5 if I need to. But the biggest thing is that it works. And so I'm confident that, hey, if you do everything I tell you to do, you're going to come back in, and they all come back in. They're like, oh my God, you think you're giving them $1 million, because they're like, oh, look at this. And yes, they can see the serial. We do the before and the after images as well, and we attach it to their charts. But I have them take it with their own cell phone so they can see the progression as well. And that helps, because people need to see. When you're working tirelessly and you can't see the fruit of your labor, it's frustrating. But if all of a sudden you're getting your foot pride back, that's huge. So that's the value of the $19.95. We're helping them with their foot pride.
Dr. Jones, do you want me to show, just tell me the 2 things I have
show
on
me
my-
the pictures and stuff that you've got there, and we'll just go from the narration from there, because I'm sure most
Okay,
of our
the
questions-
2 things.
This one particular patient had a multiple treatments. I mean, it was 3 separate treatments, freezing, her quote unquote burned off. Go ahead and cycle through. I'll talk about stuff. But she was just done with it. It's hurting her all the time. That's the final picture on it. But anyway, she came to me, personal friend or niece of a personal friend, said, "Hey, can you do something?" And typically when I'm using the Remy, I'll do multiple treatments with the fiber. But she said, "You know what? I'm just done. I want to be one and done." And so we ended up doing it with anesthesia. And as you were seeing there on that, the preoperative, fairly large, and I always debride it down first and then do the sub-Q injection for anesthesia. But then I curate out the bulk of it, and then I come back in with the laser on the base. But this particular one right here was a mess. Again, same problem. He'd had multiple treatments, came back, flared up on him multiple times. We did the repeats without anesthesia on this particular one. And when I treat patients like this, I basically tell them it's not a matter of if, it's when. And these can take anywhere from 2 to 10 treatments. And it's usually about that fourth or fifth where they really start seeing some changes. We're doing about 1 month between treatments at the end. At the beginning, and I always do about 2 weeks apart. But anyway, he was very pleased with it. Now, do we have the post? That's not post Remy Laser. We're missing the post Remy. So we did the pre, but there's one there that should be showing where it's all gone.
Let me find it. Keep talking and
Yeah.
I'll search my email.
I hope that's not the end one. Yeah. So anyway,
You're done.
but they get away without not having to do the shots by doing it in that cycle with it. But the patient's been very pleased with it. I started getting a lot of referrals from my primary care docs simply because they were seeing the results. They were also seeing the fact that we didn't have to do the anesthesia. Patients were very pleased with the results on those types of approaches with it. You able to find it there? But anyway, the first case that I was telling you about,
Give me just a few minutes.
the biggest thing about the laser on this one is most people, when they use like a CO2, it tends to be ablative in nature, and you're seeing everything go up in smoke. This one doesn't work this way, and when you do use it in that way, it actually is penetrating a little deeper than you want it to. So on this particular one, as we remove the wart itself, we're coming back on the base, and then I'm using a curette. And I'm curating off the tissue that has actually been devitalized on it until I get down to cauterization of the base, and then I let it go. So but the patient's results have been very, very good with this.
Yeah, and
Did you find it?
used to use a CO2 laser for years.
I've been using the CO2 laser for 20 years.
Yeah.
That's what I cut my teeth on. But when I was introduced to this, it was a whole bit different ball game, and I got rid of a lot of oranges picking on them, learning how to use it. But when I did do it, and she's got some pictures there. Do you have any of the nail stuff, Sarah?
Yeah, just a sec.
Yeah, you can see it with that one. And the response is very well. I mean, the big goal that I had was is be able to avoid having to use phenol, both from the reactions that patients get with it, as well as what we saw during pandemic, where it was hard to even get the stuff anymore, the high biohazard you have in your office with it. So anyway, when we started developing this, we were finding that we could get down to doing less and less and just treating the matrix itself, and then finding the healing process as being just as fast as any phenol out there. It tends to be less painful because that 810, there's it as pre-op with it. And then this is a day after you can see where we're treating that, but then the final result, and this this is just a couple days after that. This is only a week out post treatment. And so the response is really doing well. These ones right here, again, you're a week out, and it usually has just the SR on the base, and it depends on how much of the periungual lesion that you have. If there's a lot of pinic or the fire.
I'm sorry.
Here you go. There you go. Yeah, if you have a lot of the hypertrophy, the labial on that, you're going to have more of the Eschar. But we're seeing these again are a month out.
Yeah.
Minimal drainage. Patients get back to their activities real quick, and they're not doing any soaking with this. All they're doing is just wiping it once a day, and once most of the drainage under control, they're just leaving it to open air.
So why do a Remy laser matrixectomy? I think you came up with that abbreviation. You know, this is very big in the UK, and that's why I put effort into it for a lot of reasons. They can't get the phenol, but why would you want to use a Remy? Because there's a certain group, usually like you, who's used a CO2 laser and know the benefits of it. But you've really mastered this, and we're not talking a few cases. We're talking over a year and probably 75, 100. I think that's a fair number.
Oh, that is far more than that.
Yeah.
I replaced
I
all
love
my
it.
ingrown toenails and stuff with it. Yeah, I do 100% with it.
Why? Why would you want to do a Remy versus pop some phenol in or I used to use sodium hydroxide? Why?
You know, when I first started doing it, it was just to be something newfangled, to be different out there. But then I was finding out, number one, the time factor was the same, whether I did the phenol or the other. Two, I didn't have to keep the hazardous product in my office. I had a personal friend, another doctor, that put himself in the hospital because he spilt the stuff in the room. It hits your lungs. It's an issue there. The reaction that you can get from a phenol, I mean, when it blows up and you have a reaction, whether it be limited or not, or rare, I should say, the patient gets really pissed off at you. In this, when you're using the Remy, it's very well controlled. There's no spillage. There's not the extra cost. And it's fast. This right here, you're only talking a couple of minutes.
Clint, you taught me something, and then it's more precise. And tell me if I'm wrong about this. The chemical, you're just timing it, putting in. It's a blind procedure.
And that's another thing. Part of the reason why we do things like a sharp matrixectomy is we can see what we've done. The tissue is gone. We sew it up. It's done. The chances of it coming back is going to be pretty darn rare. And when you look at doing procedure like that, regrowth is not because the patient's stuff regrow. We miss something. There's a piece that got missed. Warts, the same thing. We miss something. And so with this particular one, it is the tissue is gone, so there's not going to be any regrowth with it. And again, the laser is designed for healing as it is, so it facilitates that healing. So it's a win-win on all ends of it.
And one thing you taught me, and I've listened to your lectures when you've done the anatomy. I like to call it. We used to call it a supine procedure, an open Winograd, where you know the end point. It's very objective of what you're trying to do, because if you study the anatomy, I love the way you do that. The way the matrix grows.
Yes, yeah.
How's the recurrence been? How's the recurrence?
Typically when I was thinking of it and was taught about the matrix in that area, we think of a sandwich and the nail grows out from between those two layers there. It's not. The matrix itself is only on the plantar aspect, kissing the bone. All right. And that rises up and then it rotates and moves forward. And that's why you have a superficial portion of the nail, deep portion of the nail, and you could tell which section of the matrix it came from. We do that with biopsies. Whenever we're getting any discolorations of nail, we have to look at that. So when we come in here and we use the laser, we find that the perinatal tissue, the perineum, that portion there, that's not where the matrix is. It is on the bottom proximal portion. So if this is the area that we see where the lunula is, we're only taking out my thumb. We leave this top flap alone. We take out this portion here, and the nail doesn't regrow.
How far do you think it is from the posterior aspect of the nail fold or pocket, distal? Because you're going in
as far as how big a section that I'm taking out.
Yeah.
Well, obviously it varies from person to person. A small person is not going to be very big, but approximately from where that nail, that feathered edge of it, it's only about 3-4 millimeters. But I will feel back in there. You'll feel bone, periosteum, right? Because it kisses intimately to that. But everybody's afraid to do that, and it does just fine. And again, that's part of the reason why I don't soak postoperatively, and it's not needed. It fills in very quick, heals up very quick, and people like the results.
It's like it's the MIS of nail surgery.
It is. It really is.
All feel. I know that feel because I used to do that for years. But
Well, there's feel to it, but you can feel around where the anatomy is with that microcurette that you're doing, and you can retract it and you can look, but you really don't need to. You know the anatomy with it. You can see where it is, and you can feel what that tissue is feeling like.
well, I know when I did CO2s, I always touched it up with a chemical because I didn't understand that concept. I was, oh, am I going to miss a spot? But you'd have an end point to where you know that you're done.
No, if you're going to amputate a finger, you only need to amputate the finger, not the whole hand. And you can just take out that section because you know the anatomy with it, and we train you how to do that.
It's great. Like I said, in Europe, it's wild in Europe.
Yeah, they're loving it.
They cannot get phenol and that kind of.
Yeah, they can't get that, and so it saves them that trouble. Makes them look good. It's simple to do, and it's fast. The results are consistent.
I only had one time. One of my assistants, he spilled sodium hydroxide all over the place. I mean, I didn't. Maybe that's why I turned out to who I am. I don't know what happened, but it was like I watched it burning the patient as I washed it off real quick. So,
Right.
you know,
right.
it's a different. It's not if, it's when. It's just growing. I've let it organically grow. The handpiece that you helped develop, well, you really developed it. You're a sculpturist too, which is amazing. It's got a vacuum. It hooks right into the handpiece.
Yeah.
But anyway, that's warts. That's what else we're going to talk about? Where are we moving here? Who's left? Oh, there he is.
Sarah.
I'm going to introduce Dr. Sandford. I met him. This is a very interesting, extreme. I'm lost him.
Sorry, I have myself muted.
Okay, I want to introduce him because it's been years, and I met him through one of my distributors. And it's just amazing, you know, neuropathy, we're getting very good, successful results with neuropathy, but it has to be a program. And why don't you, Doug, talk about, you know, it's the chiropractic. I had somebody say to me, well, they're getting better results and good results because they treat the back. You're not treating the back with every neuropathy patient. You're doing my unattended now. I want you to listen to how we're doing unattended too. So I'm going to just all ears and listen to you. You can say who you are.
But first off, I want to thank Dr. Zuckerman for having me tonight. And I want to really thank everything that you guys have shared, because I've definitely gained some insightful information about not only how you're treating patients, but how I can apply that in my practice. So thank you for taking out time this evening to share all that. Just to give you a 90-second history, I first started with a Remy in a very highly musculoskeletal blue collar industrial area where a lot of boats were built. So boat builders everywhere, all these bayliners, boats everywhere. So a lot of tendonitis issues and things like that. And it's so true about the you know, you want to palpate post treatment. That's when somebody's like, oh wow, that really worked. When you're like, hey, is that a little less tender? And the lights go on in their eyes and they're like, oh my, wow. They just, you know, any type of relief they can get with those musculotendinous injuries. But right now, yeah, we're running we've got 2 hands free running right now. And that was the only way to see just the sheer number of patients we're seeing. One of my lead clinicians, her elbow she had gotten tendonitis in it so bad just by running that laser just over and over for 2 years. And so we've got 2 running, and we're super excited to have a 3rd on the way to get that room up and running. But neuropathy is a protocol, Dr. Zuckerman. You're totally correct. And so it's not, it's a little more long-winded. It's usually about 18 visits over about 9 weeks. So we are going to see that patient 3 times a week for 3 weeks, twice a week for 3 weeks, and once a week for 3 weeks. But what I'll tell you is they'll come in and we'll do a basic neurological evaluation to determine kind of about what percentage sensation they've lost in their feet. And depending on that, if that looks okay, we'll go ahead and treat with, and I have to kind of, you know, cross talk a little bit on different stuff. We do use an old anodyne system, just a light infrared boot. So that's got to be part of that protocol. and then the Remy is the other. That's the only two things we use, is the boot and the Remy. So, and we send them home and bring them back 48 hours later. And I'll tell you, 90% of those patients have experienced relief of discomfort, some type of difference in their feet when they come back in, and they are just more than happy to sign up for a care protocol to get any type of relief. So I'll tell you, our clinical averages on neuropathic patients are about 6 out of 10 patients are 80% subjectively better within the 9-week program. And that lasts. We don't see patients coming back for touch-ups. I check with them later, and I've been involved in neuropathy for many years. So we've checked with them 2 and 3 years later, and their feet are still holding that progress. So that to me is a major win. And for them, it's just a huge life difference. Sarah has got a video. I don't know if she can share that at some point, of a patient that came in a wheelchair, and he left without barely using a cane. And so, and he came to a seminar that we taught at a local college and shared in front of a lot of different people. And wow, I'm gonna tell you, the entire audience came in for a neurological evaluation at that point, you know?
Yeah, I'll go
So
ahead and share that now if you want me to. That
yeah,
way.
if you want to, if you got that real quick, that'd be
Yeah.
great.
Let me just make sure I don't accidentally like play it too soon. I want to make sure I share it with sound. Okay. And I did see, because I saw you sent me this one, and then there's another one of this person on your website as well, just in case anyone wants to see
Yes.
the other one. Okay. Here we go. Share.
Tennessee. I'm here today with the Maryville Neuropathy Center. I'd just like to say, when I first came in here, I was in a wheelchair. My son brought me in. Since then, I have graduated to a pair of crutches, and today I'm here. A few months later, I can use a cane, a walking cane, can actually stand. The treatments I've had has been amazing to me, really. I can't say enough. I hope someone can get the help that I have, but also I wish my family was here. Like I was saying, they could tell you all that they've had to do for me, and since then I've graduated to where I can stand and pretty much do them on my own. I can even drive and walk in and out of here today. I'll show you. I can stand today myself, so I can stand and I can walk away. So
I will tell you, there is no chiropractic whatsoever involved in our program, just so you know that. That's how much we do of that. I don't address the lower back spine at all, unless they're actively hot in the low back, and then I'll use the laser on that, but there's no adjusting or anything with that. That would put me in the office, and that's not the goal. And then we won't talk a lot about numbers financially, but I will tell you that we are an all cash practice, and it's been very rewarding. So with that said, I will turn it over to Dr. Ellsworth. And once again, thank you everybody for having me.
Thank you.
Hey, thanks everybody. So I kind of echo Dr. Clements. I know Sarah kind of brought up the fact that I'm actually not an all cash practice. I am insurance based. I've taken, but I'll tell you, the Remy is my favorite. Dr. Butler referred to it as a Swiss Army. I call it my Instant Pot. It does everything. It sautés, it pressure cooks, you name it. And so, but I tell you, I love the Remy because while I was waiting for my office to be built out, I was doing home visits, getting paid in cash, and combining it with regenerative injections, things of that nature. And I was making a lot of cash. And that's when it opened my eyes that I was like, wow, this is my goal. And so I opened my practice with the intention that I was going to do the conventional thing and do the standard, insurance based. But then I realized that I could generate a lot of cash and with it, and not just singularly with the Remy, but combining with other modalities too, whether it's a shockwave with the Remy or, selling, products with it, packaging it with my MIS surgeries. So there's just so many ways that you can package it. And so it works well to augment everything. My mindset is very much like Suzette in the sense that I want to push and the more holistic approach. And somebody asked in one of the questions, like, is this temporary or does this actually heal? And the time that I spend with my patients is educating them that this isn't just, I can't tell you. I think I've ordered one bottle of Kenalog in the last year. I've gotten rid of steroid use. And not entirely. I'll do it occasionally, but for the most part, we have to reshape the way we think. I mean, we can't just go down the conventional path. When I first started, I mean, my husband's my practice manager, and he'd be like, "Oh, well, don't forget to bring up the laser." And I'm like, "Oh my gosh, you're right. I have this thing. How many of us have this thing and don't use it?" And so now, just like this is my new thing I've been saying, just like Instagram and like Facebook, it changes its algorithm, so should we. And so we have to start thinking and reordering in the manner in which we approach our patients. Don't save it for last. Don't just stick with, go to steroid first. I always find out what's my patient's objective. What's their goal? They want to heal quickly? Okay, here's my package. Laser, and I actually use a lot of regenerative injections as well, and then orthotics. And I give my patients a package and I tell them, here is my recipe. You cannot pick and choose your ingredients. You have to follow the protocol and the recipe if you want the outcome. And when you put it that way, the patient goes, okay, fine, I'll follow these instructions. And more like vast majority will come back in very happy, very satisfied. So I went from probably when I first started 70% insurance to 30% cash. And I've only been in practice. My practice has been only for 2 years. And then now it's then it went from 60% insurance to 40% cash. And right now I'm right at 50-50. And my goal is to flip that to where I'm 30%. I don't want to rely on insurance anymore. And my goal is to get 30% insurance and 70% cash. But I love this device. There's, I use it. I have a Swift. I hardly even use it. I got it because I needed to have it because everybody had it. And so, but I use, with Dr. Jones' protocol with the laser, he and I talked, and then I love it. I don't have to anesthetize anybody. I like the technique that he has where you go from, opposite poles to prevent that heat buildup and pain. And so I use it for warts. I use it fungal nail packages, laser packages. I use it for my post-operative pain and reduction in swelling, poros. What else? I mean, I love this thing. There isn't a day that my laser isn't being used. And I now have 3 lasers that run in my office, and my staff all are trained on it. And so most of the time lasers come in, I don't even see those patients. I see them for their first visit and I see them for their last visit. And in between, and I kind of do what Suzette does. Most of the time I emphasize, I tell them, I said, you know what, you can try the laser for 1 session. And I charge them $100. And I said, but that's like taking 1 antibiotic. I said, but you've got to finish the course. And if you do the package and you come in, whether it's weekly or if you can twice a week, so you can finish it in 3 weeks or finish it in 6 weeks. But once you complete that course, you'll see the improvement. And I tell them that each session builds on each other. And, and so I love this thing. I use it nonstop, and, I probably generate at least 100K a year just on the laser alone.
David, do you want me to answer, or do you want me to read the questions that are coming in?
Let's get through the questions. And then
Okay,
I will end with an advancement that I'm working on for podiatrists.
Cool. Fantastic, because I think that's all we've got on board tonight.
And Kairos too.
Well, I didn't email any Kairos. Okay. Let's see. Does the etiology for neuropathy make a difference in the success rate?
Oh, I guess I'll take that one.
I'm looking at you.
Sometimes chemo patients don't respond as well. Are diabetic, idiopathic, even non-controlled diabetes, if the A1C is under an 8, we tend to do real well with that. Idiopathic, no problem. So chemotherapy doesn't respond as well. But other than that, if they're, they've usually seen their GPs and got their B vitamins pulled. And so we've treated cases of even what is it, Charcot-Marie tooth disease. So we treated some esoteric causes also. And it really does not, from my clinical experience, I have not seen a huge differential with the outcome depending on the etiology.
If a patient has calcifications noted in the Achilles tendon on a plain film, can the laser still be considered for this patient? Do you want me to read that again? Because I kind of stumbled through it.
I think we got it. So
Okay.
yeah.
Who wants
So-
to answer that?
I would. I
Okay.
have no, yeah, because what you're doing, we're quieting the soft tissue down. So even if they have a huge bone spur, I don't care what the spur looks like, because when they're having pain because of the inflamed soft tissue. And my target is to quiet that soft tissue down. And I use the analogy of inflammation being like a fire, a flame, right? And so we start and we're going to quiet the flame down, and I let them know eventually you're still going to have the ember that's still there that can, you wave a fire and it's going to, a flame, and it's going to come back up. But your goal is to quiet the ember down so that they can go back to pain-free walking. And that's typically the soft tissue in the appropriate shoe.
There's
Very
tons,
good.
yeah, there's tons of patients out there that have heel spurs, but only a few of them come in for the plantar fasciitis. I think the Achilles is the same way.
Yeah.
The insertional exostosis doesn't bother them. We don't care about that. We just want to get the inflammation settled down, get the pain come down, address the biomechanics, and they'll do fine with it. So no, I don't hesitate to use it that way.
There's a handful of questions that are kind of going toward the same concept here. And okay, so most of you live, well, I just want to, so Dr. Jones, you live in Portland, Oregon, correct? Dr. Ellsworth, Austin, Texas. Dr. Butler, you're in the Boston area?
Yep.
Dr. Clements, Decatur, Georgia. Is that where?
It's close to Atlanta. It's close to Atlanta.
Okay.
Yeah.
And then Dr. Sandford, are you close to Nashville?
Knoxville, Tennessee, a little town called Maryville, just a bedroom community in Knoxville.
Okay. So the question is cash and people paying, and if you're not in an affluent community, is this gonna fly? Because of the community, the markets that you guys are serving, I don't know. Go for it. What do you think?
I'm gonna say something that is gonna sound very racist, but I'm in a predominantly Black community, and people will buy what they deem important. End of
Yeah.
story. I'm just saying.
100%.
Yeah, and it doesn't matter who you are, and people will buy it if they think it's important, but you're not selling anything. You're sharing the gift of healing.
Right.
And when you come from that approach, your job is to say, this is the healing modalities that we have. This is what my patient typically will get. And people will come in, I don't care if it's Medicare, Medicaid, and they will have a problem with a $2 copay, but will sign up for one of my things. I don't understand it, but it's done. So
It's people will pay for what they feel benefits them.
exactly, yeah.
I mean, I think for all of us, if you're sitting there thinking, oh my gosh, this is so expensive, in your mind, you've already put a barrier up for yourself. And your patient. So don't put, whatever barricades up for yourself, deflecting that off of the patient. but think about just taking the time to educate the patient. If they've been dealing with plantar fasciitis for 6 months and you tell them that you have a solution that's going to alleviate that, that allows them to return to work, they're going to buy it. And you know, I think what Dr. Zuckerman is saying is like, you know, kind of do it from the heart. It's like, don't think of it as selling, think of it as educating, and think of it as, you know, this is something that I'm going to help you achieve your goal. I am in a very mixed population. I have very affluent to working class that come in with no insurance. But when you start telling them that, hey, I can alleviate this pain, here's the protocol. And then I have really affluent people coming in that don't want to pay for anything because they have insurance, and they're like, why isn't insurance covering
I'll
this?
have that.
Right?
Yeah.
So,
Dr. Clements, we have a DP. I'm wondering, do you aggressively debride the nails when you do fungal treatment?
No, we don't aggressively do anything. We do it, yeah, we get it to where it's nice and it looks aesthetically pleasing. So all the thickness and all that gunky stuff, all that goes away. I typically, I'll have my staff start it and I'll finish it out. There's just something about the human touch for the first and the last one that makes a huge difference for the patient. When I say human doctor touch. So I will always do that because it makes a difference. And then the other thing too is we don't want to get it to the point of sensitivity. So it's literally you're getting rid of that big plaque of fungal toenail so that you can dive deep. And I use the analogy that fungus is like the basement floods. So you can't just go down there and spray some Lysol. You've got to cut the sheetrock out, get the deep heat in, and I let them know that the laser is like the deep heat. So I use analogies to help them understand why is laser going to be so much better than just a topical or an oral or something of that nature. But yeah, so we don't aggressively debride, but we debride to get rid of the big bulk so that we can get better penetration.
But Dr. Ellsworth, this has just been going through my mind ever since you said I got the switches because I have to have one. And then when you mentioned like the balance from going between insurance-based to cash-based and how that's slowly shifting, I just find that so interesting. And there's just so many physicians that just, where do you get this like no fear? Like, just like, where does this no fear come from of like just diving into all of these things that you're diving into? Just I'm doing injections, I'm doing this. Like,
Yeah,
what is
no,
going on?
I
Like,
mean,
where do
there's
you get that
no,
mentality?
don't get me wrong. There's fear, believe me. Dr. Zuckerman knows when I first bought the laser, it was the very first big ticket item I bought. I bought his laser, but I even bought an x-ray for my office. But I just
Paying
remember
off,
thinking,
like-
you know, and Dr. Zuckerman was just like, I will walk you through this. And I thought, oh, good. I have somebody that's, you know, and I see him really kind of as my mentor, but believe me, I like leaving a multi-specialty practice to starting my own practice, you know, after like 12 years and coming out, not knowing, like realizing, oh my God, I got paid from RVUs. And now I'm like, oh my God, I'm getting reimbursed nothing. Like, this is what I've been getting paid. And, you know, it's just like eye-opening, and then learning all over again, coding and billing and all the things. And so it isn't without fear, but I don't let the fear drive me, right? I kind of suppress that, and I just head down, push forward. And I think it's just a mindset thing. I mean, if I sit there and I let that fear hang over me as a cloud, I feel like it really can stall you. And so from the time that I thought I'm gonna start opening my practice, and I opened my practice in 2.5 months, like it's just one foot in front of the other, and don't think about it, you know, and just think, you know, like optimistically, because I promise you, just like if you have it, they will come. If you take the time to educate your patients, they will embrace it. And I went from feeling like, oh my God, I'm not seeing 30, 40 patients a day like everybody else, to realizing I don't need to see that many. I can see 20, 25 patients That's my happy volume. And I generate more cash with that volume than I do seeing 40 patients because, you know, I had to stop and tell my staff and everybody, I cannot be overbooked because I'm not selling shit, you know, sorry, excuse the language, but I'm like, I'm not selling anything. I don't have time to sell anything. And it's not selling. I don't have time to spend with my patients to let them know what their options are. And, you know, and I try to sell, you know, a laser package a day. I make it a goal. I make different goals for myself every day. But I think if you think all the time about quantity, you're going to be playing a game where you're just going to keep chasing. But if you stop and think about quality, that's where the fruits of your labor will pay off. Can I
Thank you.
say something really quick? I mean, what an amazing turnout tonight. But you have to believe in this device and you have to be sold on it before your patients are.
Yeah.
So
Yeah.
when you and again, I hate that I keep using the word sell and sold, but really you have to believe in it before your patients believe in it. And if you don't, it's really hard to kind of, you know, relay that information to them.
And
Yeah.
can I piggyback two things? You said number one, David, I think you're a huge asset because a lot of times there are any little questions, I will text you in 2 seconds and I get an answer. So that to me is priceless. But mindset is everything. And so when a patient comes in, they're looking at you in that white coat. Use that to your ability. You're not selling anything, you're sharing healing. And whether you want to call it healing or not, that's what I call it. You know, and my job is to help my patients heal in the quickest, most natural way possible. So when you understand that your confidence is literally what will be the difference between someone being able to walk pain-free or being able to do whatever they need to do, that's a big deal. So I don't see myself as, oh, this little bitty podiatrist on the corner. No, I'm a huge healing vessel. And I take that role very seriously. So there's a concept in coaching that says the way you do anything is the way you do everything. And when you understand that we have a huge healing, and I'm not just saying this for you, David, to make you feel good or for you to sell. I'm saying this because this has been a game changer in my practice. I think there were like, I did like 15 of these and paid off the machine. I'm just saying, come on.
That-
And look how many things I treat with this. And it's not just treat them successfully. So it aligns with healing. So to me, it's like, it's a no-brainer. But yes, like you were saying, Dr. Ellsworth, it's really the mindset. If you're a confident practitioner, you're not selling anything. You're sharing
Well-
goodness of healing. And that's really why we're here.